And of course, testing is key to finding out exactly how many Americans have the coronavirus. And as states rush to do more tests, commercial labs are struggling to keep up with the pace. Results are still pending for tens of thousands of tests because of a nationwide backlog. Our national correspondent Jericka Duncan is investigating, and she spoke to one man who waited more than a week for his results. Jericka, good morning.
Good morning to you. You know, simply put, there is a backlog in some places. And the Michigan man that we spoke to said that he waited longer than expected for his results. And it was his family who happened to go online and sort of stumble upon those results. And it's not just the sick people that this waiting game, if you will, is impacting. Hospital officials say that that is also costing them valuable resources.
I think you want to know what's going on with your body, and then what you might be facing, further ahead.
Mike Hoffer says he was left without answers for 8 days after taking a COVID-19 test.
You're in this constant worry of, is he going to wake up in the morning? Is he going to wake up in the middle of the night gasping for air?
His wife Lisa said the lack of information also left friends and family wondering if they were exposed in the meantime.
Not only can we not get answers, but we can't give answers to our employers, to our friends, to our family, people that we had been around in the couple weeks before.
Mike's test was administered by his local urgent care. But even national groups like LabCorp are reporting turnaround times of 4 to 5 days. And Quest Diagnostics tells CBS This Morning it is still working to clear 80,000 tests from its backlog. That's down from 160,000 tests nearly 2 weeks ago.
Should the private laboratories be doing more?
I think everybody needs to be doing more. And private labs are a part of the solution. My sense is that they are working as hard as they can.
Dr. Ashish Jha is the director of the Harvard Global Health Institute.
Without testing, you don't know how much disease there is. You can't isolate people who are infected. You can't make treatment plans for people who are infected.
Hospital officials say testing also helps them manage resources like bed availability and personal protective equipment, or PPE.
When it comes down to lab testing, turnaround time is PPE.
Dr. Jeff Baird is the acting chair of laboratory medicine at UW Medicine in Seattle. He says the hospital's in-house testing can process results within hours, which helps them save valuable resources.
For the hospitalized patient or the patient evaluated in an emergency room or a clinic, we need to treat all of those patients when they come in as if they had it, because if they do, we need to be protected. And if they don't, we can then relax our PPE standards and treat them in a more appropriate way.
But it's not just private companies struggling to keep up. As of Sunday, more than 14,000 people in California are awaiting test results from both private and public health labs. Many other states have yet to report specific numbers on testing backlogs. Inconsistencies between states inspired the COVID Tracking Project, which collects all the data state by state in one place. Alexis Madrigal, a writer for The Atlantic, is a co-founder.
We feel like if you're part of the national response to this epidemic, then you owe the nation transparency. What we need from them is not perfection, but transparency, honesty, and openness.
Both Quest and LabCorp tell CBS This Morning that they have increased their testing capacity right now. Both companies say they're testing around 35,000 each day, and combined, both companies have run more than 1 million tests. Tony?
Yeah, but still more work to do, Jericka. Thank you very much.